thank you so much for staying with Monday Special. Before I introduce you to my panel tonight, here's an overview of maternal health in Kenya. Let's see if we can bring those up on the screens right now. Before we get into the discussion, let's see if we can bring those up. Okay, so a woman dies from pregnancy-related causes every 2 hours in Kenya. And then we have in Kenya by 2014, maternal mortality was at 488 maternal deaths per 100,000 live births. And some of these will be explained during the discussion. Out of 10 pregnant women, up to 4 deliver at home without a skilled attendant. In some countries, 7 out of 10 women deliver at home. And finally, although there is a good and great political will characterized by a pronouncement for free maternity care, the health sector just gets half of what it requires to deliver health. And of course, this will be confirmed by the panelists on the show. Let me start with the gentleman right next to me on my right. We have Joachim Osur, Director Regional Programs for AMREF. He'll be giving us some overview and statistics of the programs they're doing. And then we have Elizabeth Nzale. She's a midwife from Makueni County. She'll be giving us some of the stories on the ground that she deals with. And finally, we have Dr. Nicholas Muraguri, PS, for the Ministry of Health, to tell us a little bit more about the government initiatives and what they're doing. Thank you to all of you for making time to come this evening. Let me start with you, Doctor. Some people have said, I would say some critics or naysayers, that there is painstakingly slow progress on maternal health in Kenya, especially in light of the enlightened approach to many development issues, including infant mortality. Is it painstakingly slow, or are people just being too critical?
No, we need to appreciate that we have made progress. For example, annually, by 2013, every year, the 488 per 100,000 live births, it translates to 6,000 women dying during pregnancy and delivery. Now, over 3 years, last 3 years, has now come down to 4,300. Okay. So we have averted annually 1,700 deaths from pregnancy and delivery-related complications. So we want we could have wanted to move faster, but we are also coming from very high levels. But also we need to appreciate progress being made due to investment being done by national government, of course in collaboration with county government, and of course our partners. A little later on, I'll ask you more about what the vision is. Also things like free maternity. So we'll come to that in just a moment. I'd like to move to Joachim and maybe tell us about the Stand Up for African Mothers campaign that's run by AMREF. In a snapshot, what is that about?
AMREF works to improve the health of women and children. And one of the big problems we have, of course, is maternal mortality in Kenya and in the rest of Africa. Now, we find that deaths happen because women deliver without a skilled attendant, with someone who is not qualified to conduct a delivery. Now, by international standards, a midwife has the skills to do it. And in AMREF, we have committed to train midwives enough to provide safe delivery.
And how long has this training been going on for?
So for the last 3 years, we have aimed to train 15,000 midwives. We are now at about 9,000. And we are in the process of doing the rest. It is not just in Kenya, it is in the region. Okay. And the aim is to have enough midwives. If you look at countries that have transformed their maternal health care, the midwives have done it. All right. The Scandinavian countries, it was not the doctors who did it, it was the midwives. So we believe that if we have qualified midwives at the lowest level possible, we can actually transform maternal health care in Africa.
Based on that training and what Dr. Muraguri is saying in terms of government initiative, how much have you seen the situation on the ground improve over the last few years?
I think maybe Dr. Muraguri didn't say something, but I think Kenya is being seen as a pillar when it comes to health policy and maternal health policy. A lot of good things have happened. Before I say the challenges, the Constitution makes health a right and goes ahead to say including maternal reproductive health care. What it means is that if you feel you are not getting reproductive health care, including maternal health, you can actually seek redress. And we've seen very good progress in the recent past. You remember at some point people are being detained for not paying hospital bills. The court has overturned that. There have been issues with respectful maternity care, where you go into a maternity and people are mistreating you. We don't expect that to happen anymore because the courts can take it up and people can face consequences. So policy-wise, including the free maternity care and even the First Lady's campaign, a lot is happening. Now what we are not seeing is translating that policy into services.
Let's come to that in just a moment. I want to hear Elizabeth before we go into the implementation of services, and of course give the doctor as well a chance to respond. Elizabeth, I'm sure you've seen and heard so many personal stories on the ground being a midwife. You're also a mother. Did being a mother motivate you to become a midwife, or were you one before?
I was a midwife before I became a mother.
What was the passion behind you becoming a midwife?
I loved to help mothers when they are giving birth, because I had seen how mothers die at home and babies also die at home, and others come to the hospital with complications of delivery and labor. So that one moved me. I wanted to be trained as a midwife so that I may help my fellow Kenyans.
How long have you been a midwife for?
I've been a midwife for the last 34 years.
34 years?
Yes.
34 years is a long time, but what would you say have been some of the more challenging things that you've seen in terms of the work you do?
We had midwives, like in my location, I had around 20 midwives, 20 traditional birth attendants who were active. So they had tender loving care for the mothers, and for the mothers to accept the midwives, the trained midwives, it was not easy. But I learned what the traditional birth attendants do, the tender loving care. I applied that skill, and also because I'm a skilled birth attendant, I also applied my skill. Again, I spent more time with these mothers in the clinic more than the traditional birth attendants. We started friendly maternal care, as the doctor said, and because we have the skill, and when we give facts to the mothers, that when they deliver at home, sometimes they get tears which are not repaired. They get complications of labor and delivery which can be easily prevented in the hospital. When we gave them facts, and when we became friends, exchanging phone numbers with them, so that when they have any problem, they can call us.
So you had to build trust.
Trust.
So some people have asked, and it may sound like an obvious question, but let's just hear it from you. In your opinion, do you recommend delivery in hospital or in the home, even if someone is at home with a midwife? But which one do you recommend and why?
I recommend a delivery in the hospital where we have facilities. There are complications which can occur at home and they cannot be managed. But in the hospital, it is very easy.
And in the 34 years that you've been a midwife, how much have you seen the situation improve on the ground in terms of these mothers being able to access health care?
The mothers who are coming for hospital delivery and a skilled birth attendant, have the number has increased a lot. Because we have built trust. We have been able to convince the mothers and also wipe out the traditional birth attendants. Like in my location, we do not have any home deliveries. That one is history. I was talking to a group of old men, and as I was encouraging them to tell the young people to deliver in the hospital, the men asked me, tell us whose wife delivered at home. I told them, even God reminded people the laws. That is why I'm just reminding you. I know that we have no home deliveries in our location, and even the surrounding locations, we have wiped out home deliveries and traditional birth attendant services. They are not there.
Very encouraging, Dr. Muraguri, and I'm coming to you next before we talk about the services. But paint me a picture, Doctor. Today, if a woman in Samburu or Baragoi wants to access maternal, prenatal, or antenatal care, is she assured that she will get government assistance?
As you may be
government facility assistance.
Yes. Also, as you're aware, during the swearing of His Excellency the President, in his speech, one of the major policy pronouncement he made was he wants women to deliver for free. And subsequently, the government invested annually 4.2 billion to be able to cover this cost. So when a woman is in labor, she simply walks into her facility, public health facilities, and walks out with her baby for free to come back for family planning and other services, also for free. So the idea is we have brought dignity to our women. So if you look at Kenya, overall in Kenya, where were women delivering at home? Not because they wanted to. It's two things: distance and money.
Yeah.
And money perhaps was the more important reason why they're delivering at home. And of course, distance. So with this 4.2 billion shilling investment, women are able now to come, deliver health facilities and walk away with their baby healthy, having been taken good care of. As that is their right, really.
Okay.
Yes.
Who qualifies for these free services?
So basically, any Kenyan.
Any Kenyan?
Any Kenyan in labor, works in the public health facilities, is given services for free.
Any, I'm trying to understand that vis-a-vis insurance and payment. Just paint me a picture.
It will come later.
Because I didn't get free.
It's a choice you made. You are covered.
It's a choice I made.
Yeah.
No, I'm just curious as to, is it anyone?
We could have paid for you.
How does one... I really wish I knew.
But this money is actually was supposed to cushion those women who are not fortunate to be covered by another insurance.
That's what I thought, yeah.
Even you will qualify. But really, we want that 4.2 billion to cover those other sisters who are not fortunate enough to be covered by any other insurance or are not able to pay.
Yeah.
But otherwise, you are qualified to get free services.
But how sustainable is that?
So we are now, the government is committed because we believe, health is a right. We believe in our women. Yeah. We say and the women are the cornerstone of our politics, our development, and the social development agenda. And therefore, incrementally, we are going to invest money to ensure that women deliver in dignity. Okay. No woman should deliver at home at all. And therefore, what we are now planning is that we are now paying service for fee. So we go deliver, we pay. But now we are moving towards from July. We are going to issue our women 1 million of them. And that gives them now liberty to decide whether they want to deliver in a public health facilities, mission hospital, or even private sector. Those have been accredited by NHIF. All right. So that's the transition. And also that money will also be able to cover the mother-child as well. So it will be mother-baby pair, so we cover antenatal care, delivery services, and mother-baby pair thereafter. Okay. So that at all the high-risk period of pregnancy, delivery, and up to 1 year after delivery, they are all covered. That way, we are going to ensure we have a generation of healthy mothers and healthy babies. All right. This is a foundation for growth and development.
I'll come to you in just a moment, but still on that point, what if it's a matter of choice? There might be someone who says, I want to deliver at home. In fact, I think you can also step in, but some people may want to make it a matter of choice.
We, for Kenya, we really want our women to deliver health facilities. Why? Should anything go wrong, we can recognize it early and respond. I just been discussing with our good nurse here. When she goes deliver a lady at home, if something goes wrong and they need to respond, the emergency response service may not be that responsive, and therefore we may be tied up where she's there with a very sick mother and not knowing what to do. We would want our women to all deliver health facilities. That way we can guarantee good quality of care and we take care of the mother. And should anything happen, we have a very good referral system from a health center all the way to level 5 hospitals, where we can out level to level 6. We're able to take care of them and refer them. And we look around the counties. County governments have also invested in ambulance services. So we're able to move our women up and down as need be. So that's the future we want. But basically, we want women deliver dignity in the care of a trained health worker.
All right. So Dr. Muraguri has talked about, some of the successes in terms of implementation of free maternity as a policy. How has it been executed on the ground?
I think the difficulty we have with health, devolution is a good thing. And I must say, because of devolution, parts of this country which were neglected are now getting attention. But it has come with its challenges as well. Dr. Muraguri makes very good policies at the national level, and we expect that the governors and their teams at the county level will take them and implement them. But there is a challenge down there because not everybody is doing it the right way. One, maybe because each county does not have the necessary capacity to do it. We don't have enough managers in the health system and enough skilled health workers to implement these policies appropriately. And so some counties are struggling. And you find that the money allocated for health may not actually go into the quality of services, into procuring the right medicines, into training the health workers, into motivating the health workers. It may go into constructing a building. And the number of people coming to the health facilities are increasing, yet you might find that we are not commensurately improving the numbers of health workers and the motivation and the procurement of medicines and so
okay,
on.
I'll give Elizabeth a chance to respond quickly, but your response to that in terms of just what he's saying, you know, you have the funds coming in, but they may not be going in to the right places or being used the right way. Yeah.
Yeah, I mean, let's step back. Is there impact? The answer is yes. If you look at deliveries, we say that 44% of our babies were born in 2013 were born in health facilities. We are now close to 70% of our children being born in health facilities. That number, it translates to from 600,000 deliveries in a year to 1.2 million children being born. It has own challenges to the health system.
Yeah.
And we must appreciate that with that number, counties are responding. Of course, they respond at different levels. Let's look at Turkana, for example. They had 2,500 deliveries per year in 2013. Today, annually, they are doing 7,500. Mandela, they were doing 4,000. Now they have doubled to 8,000. So that big number has its own challenges. But we need also appreciate and celebrate governors. Most of them have increased health workers. They have employed more people. They have improved the deliveries, materials, commodities, and so on.
Okay.
But as we sit here, there are other governors who have challenges. The money is not trickling down to the health facility where delivery took place. And we are talking with them. We are discussing with them because that money should actually go to where the delivery took place. That way, that money will be used to improve the environment. They can even employ and recruit an additional health worker, even the cleaner to make the environment good, buy uji, porridge, whatever else required, cocoa for our women, provide hot water. That is what the money is supposed to do. Improve quality of care.
All right. You can answer. We have to wind up, so you have to be very quick in your answering before we give Elizabeth a chance.
And in fact, I think that is right. What we need to do at the level of service delivery is also to work together, and this is what AMREF is trying to do by working with health workers, giving capacity. We do a lot of training, increasing the numbers of midwives. So if our governors and we are working together already, we can all work together, private sector, NGO, to correct some of the challenges that are facing us.
Then it will make a big difference. Are you optimistic, Joachim, about where we're going in terms of addressing maternal mortality? Are you optimistic at the pace that we're moving?
I think good things are happening.
Yeah.
But we could do more.
Okay.
Yeah.
All right. Okay, thank you so much for your comments. This discussion obviously could have gone on and on, but we really have to wind up. Elizabeth, your comments on I think you've touched on it a little bit, but whether or not some of these policies are being implemented. The free maternity, for example, are you seeing it working? In Makueni County, for example, where you are a practicing midwife?
Yeah, it is working wonders.
Okay.
Yeah, the mothers walk into the maternity, they deliver for free and go home for free.
Yeah.
Yeah, and they are happy. So you talked about a mother delivering at home.
At home as a choice, yes.
Yeah, but it is not happening because after sensitizing the community will not let such a thing to happen.
Yeah. It
will be reported to the hospital through a phone, and then we will be there. I went for one mother with a motorbike. Some ladies told me that somebody was in labor somewhere. I took a motorbike and went for her. It cannot happen because having the support of our county and the supportive supervisions we are getting, the support of the ambulances and everything, we cannot allow that. Even the community cannot allow. It depends on how the community has been sensitized. Yeah. Because we are in another era. Yeah.
Okay. And finally, as a midwife, do you also give basic maternal health information or teachings to expectant mothers?
Yes.
You do? Yeah.
Yeah, we do.
Okay.
Individual and also in groups.
Yeah.
Also, we sensitize the community in chiefs barazas and in all community gatherings. Yeah, like in my place, I have 5 sub-chiefs around me and around 3 chiefs. And these 3 chiefs have been sensitized. In every chief's baraza, they give healthy talks on the importance of hospital delivery.
Okay, and finally, Elizabeth, I mean, obviously you're talking about sensitization. I think what I'm getting from you is the more people have this information, the more empowered they'll feel. In as much as there's been a lot of progress, you've been doing this for 34 years, we've heard from Joachim and the doctor. What else do you think can be done to speed up the progress of improving maternal health access in Kenya? What else do you think needs to be done?
I think we should increase sensitization, health education to all the Kenyans. And when we give them facts, these are things they have seen. They have seen mothers lose their lives at home and their babies. And here we have free maternal care. then I think with the health education, we'll win the battle.
It will make a big difference. Thank you, and thank you for the work you're doing on the ground for all those families. And finally, Dr. Muruguri, this is something I want to read. According to the First Lady's Beyond Zero campaign, the number of children dying at birth has reduced from 100,000 annually to 70,000. But what's your vision? What for you is the dream, the goal, in terms of where we can take maternal health?
Really, the Jubilee government and all Kenyans believe that no woman should die when giving life. That period. We can say we can reduce this number to this number, but whose sister, whose wife, whose daughter should die? That's the thing. And that is why you see government and partners and county governments, we are investing our money, 4.2 billion nationally. The county also investing big time also to improve infrastructure, personnel, so that we bring dignity and respect to our women. The era when children, mothers will be retained for so long, children even start talking in the ward. They grow teeth in the ward. It's gone. Today you deliver your baby, get the best care possible, and you go home. You come back for other services. That's the future for us. We want a future where people do not die, children don't die, mothers don't die for preventable conditions that we can do something about. And that's the spirit of Beyond Zero. And it's good that now, everywhere we go, every Kenyan is talking about the issue to promote maternal child health. It has become a national issue, family issue, a political issue. Because we strongly believe no woman should die while giving birth. Finally, and just to be clear, I know I'm going back to the free maternity. If someone feels like they want information on this, is it available at all the counties? Where should they go? Who can they call? Who can they talk to? This information is available in all health facilities. Our health workers are sensitized the last 3 years, and that is why progressively have been seeing a lot of women deliver health facilities, and we get very good responses. And people just said a refreshing change. Where they were saying, I was retained for a month, now I'm able to walk away with my baby, healthy. I was treated with respect. I came, I was not asked for gloves, because before, on admission day, you have struggled to come to delivery room. Before admission, some facilities are told, wear gloves, where's cotton wool? In some places, even water. You come with a jerrycan of 20 liters in labor to be admitted. That's the past. So we are now looking where we have brought dignity and respect to our women. So the Kenyans, children, are born in an environment that is safe for them and also for their mother. Sorry, we're completely out of time, but I just have to ask, this is from SMS. This is Raphael Cherutoi from Baringo North. He says, maternal death is not a question of poor maternal care, for example, the lack of amenities. Rather, it is negligence by the medical practitioners and abject poverty, which most patients fall prey. I don't know if you quickly want to answer that very quickly, because we're out of time.
There are many causes of maternal death. I think for Africa and for Kenya, most of those deaths are preventable. And it is an injustice if they happen. But we cannot, well, case by case, we cannot blanket say it is negligence. A lot of good, you have an example here of a health worker who is doing her best. There are many health workers out there doing their best, but there are also bad ones who don't respect women.
And nursing care. I think a lot of people have criticized nursing care. You give birth, and then the nursing care that you're given in the hospitals is horrible, sometimes traumatizing the mothers. I don't know whether that's something that you've also looked into, Joachim, and maybe...
So one thing we do in our trainings for midwives, and I think she's a beneficiary, is really to bring in the aspect of you know, love and care and the human side of this story, because people sometimes take it as just another profession. People need to be given love. You know,
I have to completely wind up and ask a final question. I'm not sure who can. If someone is having an issue right now, if someone is feeling like this is an injustice towards me, I'm not getting the nursing care I deserve, I feel like I'm being undermined, who can they talk to?
I can answer it. I mean, really, the very good contact is really the management of the hospital where you are. They're in charge. If they're not happy with the responses, they have county directors. We have also the CEC, County Executive of Health, you can complain. But also, if you're not satisfied at that level, you have a right to complain direct from medical services. We're really the custodian of healthcare in the country. At that level, the game is different.
So county by county, those contacts are there?
Yes, there, and also you can come to the Director of Medical Services, the PS, or even the CS, if these are not being managed. Kenyans need to know that it's their right to access good health care.
All right, I think we have some tweets, and I don't know whether these are questions or feedback. Let's take a look at that. I think this is feedback, which we'll do now. We should strongly condemn culture and practices that make women deliver at home, which I think we've addressed. And then we have the government has shown commitment in resolving maternal problems by rolling free maternity program. Let's support it. All right, thank you for those tweets. Thank you to the three of you. Like we say, this is obviously something that we can discuss at length, but I believe just that information has helped a lot of people. Thank you all for the good work that you're doing, and we hope we can have this discussion soon again. We'll be back after this short break to wind up on Monday's special.